Thank you very much for those kind words, Mr. Prime Minister. Not something you ever expect to say. I have many people I'm grateful to tonight, but I'd like to say thank you to my wife. When we first started getting involved and I told you I had extracurricular activities, I'm sure you didn't expect this. Thanks for your sacrifice and reminding me to keep my heart and mind in the right place. I'd like to share with you all two stories tonight. One is about myself and one is about a patient. Early in elementary school, I was labeled as developmentally delayed. I had difficulty pronouncing most words. My principal met with me and my parents after months of speech therapy and told us that I'd never graduate high school. My parents were devastated. After the meeting, I remember my mom holding me in the car and telling me over and over again I wasn't broken. Obviously, they didn't accept the expectations of my principal. Early in medical training, I met a young boy who had a ruptured spleen, the result of a car accident. Although a major surgery, it's not all that uncommon. And with my physician supervisor, we reassured the boy and his parents that everything would likely be okay. Deep into the surgery, we realized that the damage was much more extensive than originally thought. Eventually, we exhausted every surgical option. There wasn't anything else we could do. The image of the mother standing over his body, whispering her final goodbyes, is burned into my mind. As she left the operating room, my physician supervisor put his arm around me. He said, "I know you're thinking about how you failed this family, but what you're feeling isn't failure, it's regret. No one expected that child to die tonight." Of all the things that we believe when we create public policy, expectations are probably the most important. I want you to consider the following expectations. It will take decades for Indigenous health disparities to be eliminated. Suicides, out-of-control chronic disease, and lack of access to basic healthcare services are absent for too many First Nations, and while heartbreaking, it's too complex to fix quickly. We still need more research. These aren't facts. These are expectations. And as I've come to realize, expectations can be wrong in the most significant of ways. First Nations have begun to realize this, led by inspiring leaders like those from Anishinaabe Nation here with me today, and residential school survivors like Ted Cusans. We're going into our communities and changing expectations. Utilizing a process, we're articulating problems and solutions in a way that's never been as clear, and bringing granular detail to the inherent health rights that we as Canadians all share, and the unique rights that First Nations have as a founding nation of Canada. We have a choice, but it's not a choice of whether or not we'll change. That change is going to happen regardless. It's a choice of whether or not we work together or we work apart. And the consequences of that choice will shake the very foundations of the Canadian healthcare system. It's an honor to be the recipient of the inaugural award tonight. I love this country. I am proud of my Indigenous people. And I know together we can create an incredible future together. Thank you.